afternoon. On behalf of St. Mary-Corwin Medical Center, Mike Cafasso, Chief Executive Officer, members of the St. Mary-Corwin Community and Foundation boards, many of whom are here today with us, and all of our caregivers, I'd like to welcome you and thank you for taking time to join us for our important update today. Mike will share with the community our future direction and how we will continue the 136-year legacy of our ministry, innovating better ways to move health forward and sustaining our efforts in building whole person care and flourishing communities. Shortly, I will invite Mike to speak with you. He will share remarks, and then we will open it up for questions. Our press conference will conclude at 1:30. Mike Cafasso serves as our Chief Executive Officer. He's been with St. Mary-Corwin for 7 years and is committed to our mission and our ministry. Please join me in welcoming Mike to the podium.
Thank you, Jillian, and thank you, board members who are kind enough to join us and members of our senior team. And I'd also like to say a special thank you to the media for allowing us an extra day here to share the message, this important message, with our staff before we went public with it. So thank you for that. Thank you for your patience with that. So I have a prepared statement, and as Jillian mentioned, I will be prepared to answer questions going forward. We are proud of our 136-year ministry here at St. Mary-Corwin and our commitment to the people of Pueblo, our surrounding communities, and our Catholic health ministry. In healthcare, business is changing across the nation. Health systems, big and small, are struggling in response to rising costs and constant change. Our attempts in recent years here to stabilize our performance have fallen short, and we are at a crossroads. With courageous and transformational pioneering spirit, we are taking immediate and drastic action to implement 3 strategies that will increase our long-term success and preserve our legacy. First, we will focus on our clinical strengths and concentrate on our award-winning cancer care and nationally recognized orthopedic services, making innovative strides in pursuit of whole person care. We will grow our orthopedics program to build a destination joint replacement center using the latest techniques and most advanced technology. Second, we will reimagine our primary care services to provide our patients the best and most comprehensive whole person care. We will work within our community's outstanding independent primary care partners to strengthen community-based primary care sites through increased collaboration and services. Third, we will redesign our legacy campus through master facility planning and breathe new life into the surrounding residential streets of the Bessemer and Minnequaw Heights area. We have begun the massive undertaking of the master facility planning process and plan to complete the project in years rather than decades. Making this transformation is not a single step, but an overarching strategy, which requires us to restructure how healthcare is delivered in our community. We are committed to supporting our people in the community through this rapid and comprehensive transformation with transparency, integrity, and respect, especially for our people and services directly impacted. Even through extreme challenges, we are all inspired by our commitment to our patients, which motivates us, sustains us, and creates generosity of spirit as we work together to fulfill our mission. I'm happy to entertain questions at this time.
So what areas are you said you're going to focus on your strengths. What are those areas right now?
Orthopedic services, our joint replacement program, our award-winning cancer care program, our surgical services, and our imaging services.
Does that mean you guys are closing down other departments?
That is correct in some cases.
What departments are being closed down?
So we have a medical surgical unit. We'll have the telemetry floor will be affected, and we'll see a reduced ICU.
And how many beds would you say the medical center is going to be having,
going
moving
forward?
forward?
When the project is fully implemented, we will be at 42 beds of inpatient care. John?
Mike, how many total jobs will be lost or through attrition, or how many jobs will no longer be here?
We have notified a little bit short of 300 people yesterday.
Have they been given some sort of breathing room, some sort of warning time and a severance package after that?
Great question, thank you. All of the impacted associates here have been provided a 60-day notice, so nothing will take place before 60 days. At that point, we hope to have some job placements taking place. In addition to that, severance packages will be offered at the end of that 60-day period, or as soon as that position is no longer.
So the employees that are being laid off, none of them, they have 60 days.
That's correct.
Still employed here?
That's correct.
None of them just lost their job either this morning or today, just.
That is correct. Nothing will happen before May 7th.
And I know that the birthing center closed last October. Was that kind of the start of this new implementation? Did you guys have any idea that you might have to be moving in this direction at that point?
Well, I will tell you, for the last 8 or 9 months, we've been working rather aggressively on a strategic plan that will allow us to grow and sustain this mission. That was certainly part of it, but not part of the planning process going forward. We worked with physicians, we worked with the board members, we worked with our executive staff, and we worked with professional experts in the field of healthcare to determine our best path forward. We looked at 5 different scenarios, none of which included closing this hospital. We narrowed it down to the one that I just set before you earlier.
Sir, how do you, all due respect here, how do you kind of grow and continue to build on this mission by closing down parts of this hospital and cutting away staff?
Thank you, that's a great question. Where we are today, we are not sustainable in its current mode. So as I said earlier, our efforts to move things forward and to sustain and grow have not been successful. So it's time to focus on fewer services and try to grow those, regain financial footing, and go from there.
What, how dire is the financial situation right now for you guys?
Well, we are stable but not growing. And it's important for us to be able to have enough to reinvest back into our mission. That's not the case today.
And you spoke about redesigning the campus. Do you have specifics in mind of that? Are you taking part of the hospital away? Do you know yet?
Well, as you drove up to the campus, you know it's a rather large facility. We probably only use maybe a third of it, especially for patient care. The most eastern tower has been empty for some time, and part of our planning process is to, number one, take a look at what we can move and concentrate, and then what can we begin to take down and revitalize the neighborhood with new facilities or other aspects and potentials for the community in this neighborhood.
So new facilities are going to be built?
Potentially, yes. I think that's all part of the planning process. We don't know exactly what yet, but I think the important thing is we begin to remove the dated and unused portion of this campus, which frankly probably should have been done some time ago.
So could that money that's being used to potentially build things, that couldn't have been put back towards funding people, the employees?
Different source of funds. And again, the mode we're in now is just simply not sustainable. We can't continue to be all things to the community and sustain.
Have you been in contact with Parkview at all, or any other hospital about these employees who are about to be laid off, these little short of 300 employees, finding them a job?
We have a plan in place that will be taking place over the next 60 days through our Human Resources Services group. We have an in-house career fair. We'll have an external career fair. And in the meantime, we'll also have our HR people working diligently to provide any opportunity and any posting to take place for that. We work very hard and will continue to work very hard to make sure all of these people, wherever possible, will be placed.
How did you guys get to this point where you guys couldn't sustain or grow anymore and you decided to go to this plan? How did you guys get to this point? What was the process?
I'm sorry, I don't understand the question. Going forward, how did we get to that process?
Yeah. Just what has been the timeline for the most part that you got to this point where layoffs had to be made, where you can sustain or grow or anything like that?
Well, I think last summer, as I mentioned, we began this process of strategic planning, and we had to look at all options because it was made clear to us where we are today is simply not sustainable. So as we looked at 5 different directions and settled on one, at that point in time, we began the work around how do we build these areas and at what cost will we have to do to get there. So It was at that time that process began. But I will say right up until last Friday, decisions were made on how this plan would move forward. There's a lot of time, a lot of work, a lot of expertise, and frankly, a lot of thought. This is a very painful process for the people involved, not just those that are affected directly by leaving, but also those that remain here as well.
And how did those employees who are affected react to the news?
Well, like most, whenever you hear that type of news, there's a shock. We had sessions throughout the course of the day yesterday, which is the reason we were waiting for all of you to be able to be here today, and met with them all one-on-one by group. We had 6 teams of 3 throughout the hospital, which included leadership, which included our EAP person and our HR person walking the floors, getting into greater detail with each and every one of them, responding to questions. This morning we had town hall meetings. We had one at 6 a.m., one at 8 a.m., and we have another one this afternoon and one this evening to just continue to provide answers for our folks and direction. And there's been some good questions, but the idea is to be present, to be transparent, and to do whatever we can to help these people get through these challenging times.
Some of the employees said that if they were to talk about what was going on social media or talk to the press, that they would lose their severance package?
I don't believe that be the case.
What does the severance package look like?
It varies based on position and time here at St. Mary-Corwin.
Okay, and there is no guy going around them talking to?
And obviously, when you have social pages, and it's not something I have, so I don't know all the details of that, but if you're on St. Mary-Corwin page, that might make an impact, might make a difference for us. We have a policy here for our page and our employees on our page, but when it comes to their own personal pages, that's not something we can control.
Are any of the other Centura Health hospitals being affected by this, or was it kind of targeted here at St. Mary-Corwin?
Well, our charge is to address our hospital here. I'm not sure what exactly is going on at other facilities.
And I guess, I mean, you spoke a little bit about this, but 300 people, I mean, that's a lot to be losing their jobs. For somebody who might be watching this tonight, who just got the news yesterday, really still hasn't comprehended it, can they get a personalized kind of message from you? I mean, what would you say to them?
If it were me, I'd say, first of all, this has been strictly the state of healthcare and the conditions that we're all living in right now. I don't think you can go too far across the country and find communities that aren't directly affected by hospital closures, hospital layoffs, or bankruptcies. That's just happening as the state of the industry and the condition it's in currently. Number 2, this has never been about the quality of the care that we offer here. This has strictly been a financial challenge for healthcare in general. So I would say to them, we remain safe as always. We'll continue to offer the services we have. We will look differently. We will not be as full scope as we were at one time. Our services will be narrowed, but we will still offer the great care that we've offered our community over the past 136 years.
Has a drop in patient care led to these plans?
A drop in the quality of patient care?
No, just the amount of patients who come into the hospital.
No, it's not been a volume issue. It's really been around the business conditions and reimbursement rates.
For a hospital that's been here since, what, the 1800s?
Yes.
How do you continue to, adequately serve this community with just over 40 beds in this huge facility?
Well, I can tell you, as the 42 beds we have and the services that we offer, we will continue to do whole person care to the best of the staff's ability going forward. But it will be limited, or it could be bigger challenges down the road if we didn't take and adapt today.
How many beds do you have right now?
There's 114 active beds right now.
And then in terms of staff at this medical center, I know we're cutting almost 300, but how many total staff do you have right now?
A little over 800 full-time people.
So almost half.
Yes, actually 900 if you include part-timers. Yep.
Any final questions for Mike? Mike, would you like to add anything?
Well, I just want to remind everybody again, we've generated and pulled together this plan going forward with our primary strategies being our clinical strengths in orthopedic and cancer care, engaging with our primary care physicians in the marketplace, and working to redesign, redevelop the neighborhood here going forward.
I have one more question. Are any administrators being laid off?
We have, yes, there are people at the senior level as well being affected. We're actually having to redesign a lot of positions, so many of them have been impacted by that as well.
Do you have any sort of breakdown on personnel in terms of what departments are being cut?
Other than what I've mentioned earlier, I don't have any further detail. Thank you all.